Aloha and welcome to Remote Promote. For those of you joining us for the first time, Remote Promote is a project that was created with an intention to support business owners and entrepreneurs, and that the online communities would have the honor and pleasure of working with these talented entrepreneurs and business owners. And so today it is my distinct honor and pleasure to introduce to you Donne Soga. And Donne is a Medicare Advantage Supplement Consultant with Premier Benefit Consultants. And she's been doing this for 7 years. She spent most of her career in retail and wanted to do something different where she could be more of a contribution. And she loves the difference that she's able to make with seniors. So thank you so much for joining us, Donne, and welcome.
Hi, Maureen. Thank you so much for having me. It's a pleasure to be a part of this Remote Promote.
No, thank you. Thank you very much. So Donne, I'm just going to start by asking you some questions. And the first one is, what challenge is it that you solve for your clients?
Well, if you ask someone what are their thoughts on Medicare, you'd probably get a response like it's confusing, it's complicated, it's hard to understand. So they are in need of having some questions answered. So that's what I do. I help to take out some of that confusion and frustration and really help answer their questions. Most people qualify for Medicare at age 65 and have questions like, how do I apply? When do I apply for Medicare? What do all those parts A, B, C, D, what does that mean? What does it cover? What do I do if I plan to still work when I'm 65? Do I need to sign up for a Medicare Advantage or Medicare Supplement plan? And what's the difference? And then most importantly, they always say, and then how do I choose the best plan? So that's really what I'm here to do for them.
Well, that's really great. And why are you inspired to do this, Donne?
Well, it breaks my heart when I hear of seniors that have been taken advantage of and maybe even the victims of a scam. And I really feel that this is a time when they need help with their Medicare. So I want to be that trusted person that can assist them. Many seniors tell me, I don't have anyone to help me. My children are busy, or my son doesn't even live in Hawaii. It's so good to have someone to talk to help me. So I sit down with them, preferably in person. Things are a little different now with COVID, but I talk with them and really get to know them. I want to know what their needs are, and seniors love to talk. So once I start talking with them, they tell me about their family, they tell me about their interests, their hobbies, and as a result, I really am able to find and help them find a good Medicare plan. And I hope that they feel like I become part of their family and I can treat them like their family to me. And I get to do all of this and provide this service to them without ever charging them a fee.
That's really, really great. And what territories do you serve, Donne?
So I am licensed to serve anybody in the state of Hawaii.
Perfect. So even if you're not on the same island, you can still service.
Yes.
Oh, that's great. All right, awesome. And then what would you say sets you apart in the field that you're in?
Well, because I consider myself to be a consultant, Premier Benefit Consultants is an agency in Hawaii that represents more Medicare Advantage and Medicare Supplement plans than anyone else. So I represent plans like United Healthcare, Humana, Ohana, Aloha Care, and we are the only agency that represents HMSA. So we really can, or I really can be a consultant if I represent all the different plans. Oftentimes, people think that there could be one plan that fits all, but in Medicare, there's no such thing. So there really isn't one best plan. It just depends on the individual. Every plan is good for someone. And I hope that in the end, I become, their advisor their healthcare advisor. In addition, I've kind of specialized in working with employers and business owners, HR managers, to help their employees when they're ready to retire. So they may come walking into the HR office with some Medicare questions, and the HR manager is not necessarily versed in Medicare. That's not necessarily their priority. So they partner with me, and they can tell them employee, hey, I have someone that you can call. You know, give Donnie a call. She'll help you. She'll answer your questions better than I can, and she'll guide you along the way.
Hmm. I just love your heart for helping people. It's just really, it's very clear. And
Yeah.
last question is, what is the current challenge that's faced by your clients at this time, and what solution do you have for that?
Well, the COVID pandemic, you know, of course, has affected us all, and it has really affected this group of seniors. So um, many 65-year-olds that are still working are are finding themselves furloughed. I've been getting a lot of calls in the past few months with people not sure when they're going to get called back and their medical insurance is about to end. So I help them to get their Medicare insurance in place, hopefully without a gap in coverage. And then unfortunately, a few of them have are working for companies that have chosen to close,
Hmm.
and they are being forced to retire. So you know, they didn't intend to retire. They're now forced to look at retirement. Um, and again, I'll help them to make sure that they have health insurance. As you get older, health insurance is so important. So they just don't know what will happen. And of course, there's always that possibility of being affected by COVID. You don't want to ever be without health insurance at this time. Um,
Mm-hmm.
the other challenge at this currently with the COVID is I can't meet with them in person. I, you know, go to their homes like I used to. That's not something that people are comfortable with, and we should not. We should probably limit that. So I have done more on the phone and video calls, Zoom or FaceTime. Even utilizing, we have more electronic enrollment platforms available to us, so we can even do remote signatures. So
That's great.
it's really helping the seniors to feel comfortable that, okay, I don't really want to have somebody come into my home, and I don't really want to go out and meet at your office. So that's how we've adjusted
Mm.
to that situation.
Oh, that's really great. Well, thank you again for joining us, Donnie. It's been so great having you.
Thank you, Maureen. I've really enjoyed this time talking with you, and I appreciate you
Yeah,
spending time with me
likewise.
on Remote Promote.
Likewise. And for those of you listening, if you have a business that you'd like to showcase here, please reach out. Or if you know someone that would like to, then we'd love to hear from you as well. And until next time, aloha.
Aloha.